This presentation is on rheumatoid arthritis. An individual that has rheumatoid arthritis has an autoimmune disease that inflames the synovial tissue lining and the inside of the joints. This usually happens on both sides of the joints. Here are some roles an individual with rheumatoid arthritis may have. He or she may be a mother, father, son, or daughter. He or she may work as an educator, contractor, doctor, or secretary. Some personal roles might be a wife, husband, caregiver. Some daily roles are getting up from 9 to 5, working from Monday to Friday. Some activities of daily living are showering, cooking, and dressing. The person is able to perform these tasks but usually has constant pain or stiffness. Some signs and symptoms of rheumatoid arthritis are loss of appetite, fever, fatigue, overall stiffness, and stiffness when you wake up. Some of the joints affected are thumbs, hands, wrist. These are the smaller joints of the body. And the other joints include elbows, shoulders, neck, hips, knees, ankles, and feet. So here's a video about a woman with rheumatoid arthritis. It will show you a lot of different things. And I'm just bringing it up now.
Imagine feeling intense pain every time you tried to open a can of soup.
Sometimes it's a stiffness, sometimes it's a shooting pain. Sometimes joints can lock. Like for a long time, my fingers don't lock now. For a long time, my fingers would lock. They're called trigger fingers, and I learned to pry them open myself.
So these are some of the symptoms this individual is facing. As we progress, you will see that the doctor is prescribing some physical exercise, some diet, some vitamins. I would like you just to pay attention because we'll be covering some of these aspects later in the PowerPoint.
When she was a 19-year-old college student, Sandra Weirs has struggled for more than 20 years with rheumatoid arthritis, a chronic disease that causes painful inflammation of the joints.
I had about 30-degree range of motion in my right arm. Sternum where my ribs connect. I couldn't breathe all the time because it was inflamed in there. So just things like getting dressed, putting on a t-shirt or a pair of sweatpants could take like close to 20 minutes.
The inflammation can actually eat at the bone and the architecture of the joint, and there can be deformities, and people, once there's deformity of the joint, then people lose their ability to do things. So it can be a crippling disease left untreated.
Although the cause of rheumatoid arthritis is not known, doctors say they know that cells from the immune system invade the joint tissues, causing a reaction that results in inflammation and extreme pain, which affects more than 1 million Americans, mostly women.
They're crossing.
Early diagnosis and drug therapy can control the progression of the disease, but pain management can be tricky.
Feet and ankles and knees, because we have to walk to get everywhere as a general rule, are a particular problem for people. But really the hands and wrists are the things that people use the most during the day. For they have to manipulate. You eat and you write letters and work on the computer now.
Doctors recommend starting with pain relievers like ibuprofen to reduce the stiffness and swelling. Heat can also help tight muscles relax, and ice can help cool down hot, swollen joints and reduce swelling as well. Smoking can make rheumatoid arthritis worse, as can carrying excess weight, so exercise is crucial.
Just a little fact here. When you're taking the ibuprofen, you don't want to do a lot of movement or excessive movement because there is a correlation of having more swelling and the tissues do not heal as well. There has been a study on that. So I just wanted to pinpoint that if you do take ibuprofen, make sure that you're at a sedentary state, that you're not going to do a lot of exercise or constant motion, because these studies have proven that the swelling actually doesn't decrease, it increases slightly, and the tissues do not heal as well.
Not having pain and swelling in your hand is an excellent time to make those joints as strong as possible. Now, because there is a component of wear and tear always for all of us when we exercise, we often ask our patients to exercise in water. Some people find that if they cut back on carbohydrates and sugar, that helps their arthritis. People oftentimes feel like apple cider vinegar helps their arthritis. Sometimes they think that black cherries is good for their arthritis. When it comes to spices, some people find that turmeric or curcumin helps, or garlic helps. And again, I always tell my patient, what works for you is what works, and that's what's important.
Learning how to do the simplest things without causing further damage to the joints is also key.
So I never ever shut a car door with my fingers, ever. I'll use my elbow, I'll use my hip, I'll use my leg, I'll use the shoulder. Same thing, you pick up a pot. If you pick up a pot like this, all the weight is going against your fingers. So whenever possible, you want to get pots with handles on both sides so that you can come under them and lift up with a uniform pressure. Early on, I couldn't fix the flare as quickly as I can now. I really had to learn to listen to my body and work with it and not try to force it. It gets frustrating because we want to be able to take a medicine or rub a cream or say, well, I know this always works, and it doesn't. And this one thing this disease has really taught me is listen to myself and get to know my body and take care of myself.
So on my next slide, I'm going to have some rehabilitation treatments for rheumatoid arthritis. So this is the physical and mental perspective of how you deal with rheumatoid arthritis. There's an ideality and reality. The ideality is that you want to exercise, diet, and have relationships, go out all the time. But the reality is we struggle to maintain these physical exercise, the diet, the relationships. But we just have to keep on chugging and find those family and friend supports to help us get through that. So the rehabilitation techniques for social and psychological is to increase the areas of occupation, the performance skills, the performance patterns, and the body structures and functions. You want to help the individual in the functional independence with service. If you are a professional, you want to include the family in this. And you want to remediate the client in maintaining the lifestyle and roles of others and themselves. So you want to create a meaningful goal that's directed towards their activities. You want to keep them in mind in this and how they feel. And then you want to regain the occupational roles in their environment and maintain them. And you want to create meaningful activities that help their cognitive, social, and psychological issues that they might be having at that time. But most importantly, you want to increase the overall functional independence of the individual. So in this slide, here are some physical rehabilitation techniques. You can maintain joint range of motion, you can splint the affected area like this nice little picture here. You can have the modalities of paraffin, hot packs, ice packs. The paraffin is an example is this lady using paraffin on her face, but you would use it on the hands, ankles, etc. Some other stuff is resistive exercises with gravity eliminated as shown in the video, the water aerobics, and this little cute picture here. Also, you want to maintain endurance throughout the day by modifying your activities, for example, taking breaks frequently. And also you want to provide joint protection and prevention. On my last slide, we're going to include the cognitive intervention because it's not just about the physical or the emotional. You also want to do the cognitive and how they're thinking. So you want to teach them the limitations on how to prevent overexertion, like taking more breaks. You want to teach conservation techniques. You want to teach them stress management, like tell them to go to yoga or do something that they like that relieves some of their stress. And you definitely want to educate the individual on problem solving skills so they can modify the things that they do every day, that they're able to jump on something, that they're able to perform themselves. It helps totally in a mental way. So here are my references, and if you have any more questions, there's online references, 2 book references, and a journal article listed here. I hope you enjoyed this presentation, and you have a good day.